Okay. Good morning, everybody. Ed Harbison here, the chairman of the Study Committee on Sickle Cell Disorders and Diseases. And I'm certainly glad to have you with us today, whether you're here in person or whether you're online to zooming in with us. I want to, first of all, express my appreciation to members of the staff and Alex and the gang and everybody who's done their due diligence to make this happen. And we really, in my estimation, have gotten some good information that hopefully will help somebody down the road with such a dread disease. People are in pain, and that really got to me when people talk about how much pain they're having. Chairman Kirkpatrick, I understand you're online. We thank you for being here with us as well. We appreciate it, and we look forward to your input. So we're here today to sort of sum up what we're going to do and prayerfully offer forth to somebody to get something done for the people who suffer with sickle cell anemia around the state and hopefully around the country. Anyway, I'm glad to hear my chairman here, the leader here as well, Senator Butler, and we appreciate you as well. You're online, and I understand Senator Jackson will be joining us pretty soon, and we can perhaps use that to get some final destination for our recommendations that will be coming forth. Thank you very much. Senator Butler, you want to offer something in right now, and let's get started on where we are, and then we get Alex, and we'll sort of get going with that as well. Number 7, thank you. Yes.
Thank you, Mr. Chairman. I appreciate you bringing this committee on sickle cell disease to us. And it's been a great committee and great information. And I appreciate all the ones that presented to us and brought the information that we really need to move forward with either legislation or more work or whatever's needed to get this condition under wraps. And I do know about the pain that it causes. Years ago, we looked at this issue, did some monies in the budget for Grady, and because they have that unit over at Grady. And so I really appreciate you continuing this work so that we can help the people of this state that needs the kind of help that we can provide. So thank you, and I look forward to voting on the committee report so that we can move forward and get some things done for 2022.
Okay, and then what I'm going to do is refer to our staff person right here and give us an idea of how we need to go about including and in making sure we got all of the information. You'll compile that for us once we get it into a cogent kind of methodology and a form.
For the recommendations?
Yes, right.
Yeah, so today I'm number 9.
Okay, I got you. You on?
Okay. So what we did, I sent out a request for all recommendations over the past several weeks and compiled them and then put them into the final draft report. Senator Jackson, after the deadline, she submitted additional recommendations, and some of them modify some of the existing recommendations that are in the draft report. So what I did in this separate document, this one pager, I incorporated her recommendations into the existing recommendations. So it reads more like a committee substitute instead of.
And this is a summation right here.
Yes, sir.
Okay.
On that one, and you'll see on the top, it just says italicized language reflects Senator Jackson's recommendation.
Okay. Well, let's go through them one by one then, and then we can take a final vote of whether we want to expand it or condense it or however we want to do it. Okay.
Yes, sir.
All right. All right. Any input from Senator Butler or Senator Kirkpatrick or Senator Jackson if she's with us?
No, I didn't have any.
Okay. Well, why don't I read each one to make sure that we on board with what we're talking about. It's 1 through 6. And the committee submits the following recommendation. Number 1, leverage existing resources such as federally qualified health centers, FQHCs, and county health departments to improve treatments around the state by connecting them with sickle cell experts for consultation. And I know we had that long debate and we talked about the spokes that need to go out into places like Columbus and Macon because Augusta has one. That was a great deal of concern to us as well. Number two, work with Georgia medical schools and primary care residency programs to improve sickle cell material in their curriculum. That's an excellent idea. And it perhaps is already being done, but if it's not, well, they really need to get it done. Additionally, incentivize hospitals, emergency centers, and non-specialty providers to take advantage of available training and increase SCD training availability. Now, listening to my advocate in Columbus, Georgia, I think that is one of the biggest things that we can get done. Apparently, there are crises. People have episodes and they go to the hospital and they really don't know how to treat them. This is what she said. So perhaps this is a way we could look at that and perhaps get that in place as well to alleviate that situation. Number three, establish an intercity shuttle bus system or a subsystem to an existing transit system in each medium-sized metro area to serve sickle cell patients in the state. Or consider the use of mobile units to transport Grady specialists from Metro Atlanta to underserved rural and medium-sized metro areas on a quarterly basis and establish mechanism that will facilitate such resource sharing. And that sort of bleeds up into the other one as well, all right? Any input on number three? Any comment, input online or otherwise with us? Otherwise, I'll keep going. We've been joined by Senator Anderson, Chair of GLBC. Glad to have you, Senator. Appreciate you coming by. Number four, what we're doing, we're going down the list of recommendations to make sure we're all on the same page and it's all inclusive to our efforts and our thinking. Establish a clearinghouse to coordinate between Atlanta and medium cities along with medium funding for those areas. Additional funding for those areas. This will help utilize and maximize Grady Memorial Hospital's resources and knowledge to assist for those smaller cities. Additionally, establish mechanism to allow data sharing between funded community-based organizations and clinical organizations to reduce the number of individuals lost to follow-up through the provision of community health worker services. That's number four. Any input, comments, or addition or takeaway? If not, I'll proceed to number five. Number five, expand access to medical care and support programs that aim to create meaningful and sustainability change for sickle cell patients. This should involve scaling up existing programs and services to expand access to care to additional areas of the state, including funding for additional mobile units. That's a big deal. And additional hematologists to expand coverage areas and funding to sustain current community health workers and place additional workers in the most underserved and southernmost parts of the state. Comments? All right. And while the final one is this, number six, create a pathway for extending Medicaid benefits to Georgians age 18 to 25 years old living with sickle cell disease, regardless of their SSI disability status. And that's all number six, all the recommendations that we got from hearings, from Zoom calls, and from people here on this panel. Is that right? All right. With any comment?
I don't have that particular.
You don't have this?
I don't have that sheet, no.
She does not have this.
With the recommendation. Is it in here?
Yep.
I've been there.
Yeah, so these were
I was just
these
looking
were the
at the
original
report.
recommendations, and then
Yeah,
Senator Jackson
Okay,
submitted some.
Now, this is a
additional-
condensation of all of them, right?
Yes, sir.
All
Yep.
right. All right. Now, I understand that Senator Jackson will let her know that we did infuse into hers into ours. I mean, the overall committee.
Yeah, I
as
was in
well.
communication with her.
Right, right. I spoke with her. She's called me a couple of times because she was very concerned about it, that she couldn't be here. In addition, she wanted to make sure her recommendations got included. and they have been. Any other comments, opinions? Well, I got to tell you that it has been very illuminating to me to go through this particular committee, and I really appreciate your diligence and getting this looked at in the proper order. And perhaps we can come up with some kind of legislation, maybe that would direct, but it's always easier to come up with something that you can just make happen by way of this established rule of order, so to speak. But we can do that either way. If we can get it done, does anybody here see any laws we need to pass? Any input we need to do with certain areas? I want to make sure that our fund is expanded. That's one thing. I really want to make sure we do that, because I think it's just, I know that we've had people working diligently over the years to increase it from a little bit, I think, to $700,000 now. But before it was just, I mean, it was what, 50,000, 60,000, zero. I mean, so it takes a long time, and that's good. That's good. But as long as we get it up to meet the needs of our citizenry who is struck by this disease, I believe we'll be okay. But if there are no other input, yes, Senator Anderson.
Thank you.
What number are you?
Thank you, Mr. Chairman. I really want to say that I am overjoyed by these recommendations and the work that's been done. One that I specifically have spoken to a couple of times is having more doctors that work in that area, in that specialty, in the specialty of sickle cell, because not knowing puts the patient, in a more critical state, in a more critical position. And so I really appreciate having this addition for the curriculum to be expanded to include sickle cell material. So I really, really appreciate having that in this recommendation.
And Senator Anderson, it even came up during our meetings as I want to say it was in the 70s, mid 70s. Sickle cell anemia was a hot topic. I mean, we were all on board. We had public service announcements going, we had people meeting about it. We had it in the laws in the Congress and the houses of representatives and things like that. And all of a sudden it just sort of faded away, but the pain kept going, didn't it? And we just sort of looked the other way because I guess nobody was shouting loud enough, you know what I mean? So perhaps this will be a loud enough shout to get somebody's ear, and we can do something about it in a positive way and get it done. So what I would like to do now is get the committee to formally adopt the recommendations of our study committee and pass it on, and hopefully we can get something done.
I move that we adopt the committee recommendations reflecting the sickle cell anemia trait and disease.
Second.
Moved and properly seconded. All in favor, say aye. Aye. Opposed, like sign. All right, we've adopted the recommendations and should be forthcoming. We got a good report, I believe, and hopefully, once again, I believe, prayerfully, we can get something about it. I want to acknowledge Senator Kirkpatrick online and Senator Kim Jackson as well. I don't know whether they called in or wanted to call in, but they've been vital cogs in this information. They've been vital cog in this information process. So I just want to thank them as well for being with us. Otherwise, if there's no other business.
So part of that decision you make, your ramifications. Cybersecurity, yes, I'm leaving, you and even in the Senate, calling the residents.
She said she supports, she put it in the chat,
We're starting up this next year.
the recommendations.
All right, we will record your vote as well, Senator Kirkpatrick, Chairman Kirkpatrick. That was sort of, is that what she said?
Yes.
Right? Okay, I thought I was right. We got you. We got you, Madam Chair. Thank you very much. Any other business come before us? Otherwise, we stand adjourned. Thank you very much, we appreciate you.
Oh,
You kept me on task, even though you're in the Army. You're still a good guy. Any other comments? Thank you very much. We stand adjourned. Thank you. Appreciate it. Make sure you turn in your sheets.